Hey guys, Dr. Rob here, and I wanted to welcome you today to another one of my whiteboard sessions. Today I'm going to be talking to you something a little bit more on the serious side, and that is the supplementation with a particular vitamin has been shown to significantly increase cancer rates. This particular vitamin is in many of the nutritional supplements that are bought off the shelves. It's also in many multivitamins. And the name of that vitamin is folic acid. And I want to explain to you, folic acid is often administered to women that are pregnant. They're told to get 800 micrograms of folic acid per day. The problem is, in a study that was done in the Journal of Clinical Nutrition, that was found to increase female breast cancer by between 20 and 30% for those women that took the increased amount of folic acid. Folic acid is a synthetic form of what are called folates. Folates are natural forms of B vitamin that are found in nature. And the natural forms don't seem to pose any problem to the body. As a matter of fact, they help the body do a lot of amazing things. The problem is these synthetic forms are not what God created for us. They're not intended for the body. And these synthetic forms can cause big problems. Some of the other things that were shown by taking supplemental folic acid. Again, folic acid is different than some other forms that I'm going to talk to you about in a minute. But some studies that were done, one study in Norway showed an overall increase of all patients, of all people, for all people that were taking folic acid. Another study that was done looking at US, Canada, and Chile found that these people that were on what was called the folic acid supplementation program, which was a program that was developed where our foods were fortified with folic acid. And this was supposed to help create deficiencies. The problem is the study showed that that addition of folic acid could have increased colorectal cancers. Another study, a randomized control study that was done, showed the daily use of 1 milligram of folic acid per day, again the synthetic form, increased your risk of prostate cancers. There's another study that showed, and researchers even feel, that all foods that are fortified with folic acid and or nutritional supplements that have folic acid added to them can increase the risk of all cancers. So this is a very serious thing. This is something I don't want you guys to take lightly. I really want you to focus in on what I'm saying here. Okay, so ideally we want to get our folic acid from food sources. That's the best place to get it from. And there are many foods that are easily incorporated into our diet, which I will cover with you on the next whiteboard session. However, when we're looking at nutritional supplements, check your multivitamins. If that thing says folic acid, talk to your doctor if it was prescribed by him. If it wasn't, consider throwing it out and getting a good quality multivitamin. For example, the multivitamin that I have manufactured that's called Multi-1, there's no folic acid in there. There's what are called the active or natural forms of folic acid. And there's two big ones. The first one is called 5, you ready? Methatetrahydrofolate. So it's 5-methatetrahydrofolate that you want to look for on your supplement label. It might also be listed as 5-MTHF. So either one of those terms can be used to describe a natural form of folic acid that your body could use that has not been shown through any clinical research that I know of to increase cancer rates. The other one is called folinic acid. Folinic acid is a folate. It's part of the folate family. It's similar to this 5-methatetrahydrofolate, but it's a little bit different. And it's a natural form, and from all the research I've done, it does not increase your chances of cancer. This is what's found like in asparagus, for example. So check your multivitamins. If you got folic acid, consider tossing it out. If you're pregnant and you're on folic acid, talk to your doctor about some other options, about some potential natural options like using folinic acid or using 5-methatetrahydrofolate, because either one of those, in my opinion, is going to be a much better source. However, you have to talk to your doctor about that, okay? So I hope you guys enjoyed this whiteboard session. Please take note of your multivitamins. Make sure you're on a good folic acid that is natural, folinic acid, or the 5-MTHFR. And I'll see you at the next whiteboard session where we're going to discuss foods that are awesome, delicious, and high in folic acid.